Walter Zelman is the principal healthcare advisor to the Department of Health and Human Welfare. He's a graduate at the University of Michigan, did graduate work at the London School of Economics, and got his PhD from UCLA in political science.
I think I'm a good teacher. I'm not much of a researcher. I've written some books. I wrote books based on other people's research and what that meant for the changing healthcare system and what that means for public policy. I grew up in a very progressive environment. I lived in Queens, but I went to a small school in Greenwich Village, and I largely hung out in Greenwich Village. Angela Davis was in my class. Well, politics was in my blood very, very early. When I was about 8 or 9 years old, I got pneumonia and had to stay home from school for several weeks. And it happened to be the exact time, and it was the Senate McCarthy hearings. I watched the whole thing with my mother, and she would explain to me what was going on. And my father was the attorney for the teachers' union. So every night I would hear at dinner about how he was defending the teachers because they were losing their jobs because they wouldn't tell McCarthy whether or not they knew any communists. I really didn't get into healthcare. Healthcare got into me. I was the head of Common Cause in California. The best way to tell the story about how the special interests were dominating politics was to pick an issue or two on which the special interests were most dominant. The biggest disparity I could find in politics in California and policy in California was health insurance. That led me to run for insurance commissioner. And when I lost to Garamendi, he asked me to come work for him. We developed a health plan for him that we sold it across the country. We sold it to the New York Times. We ran a great editorial. And soon enough, I was getting calls from the Clinton campaign. It was 1992, because Clinton liked it. So Clinton seized on our plan, and I ended up going to Washington for 2 years. And I've been in healthcare ever since. I worked in the Clinton administration for a while. And then I had a small stint at USC, and then B. Yorker, who was then dean of HHS, called me and asked me if I'd be interested in this position. I've been chair ever since, and it's been fabulous. I love public health. I love Cal State LA, and it has been a great place for me to land. I love the students. I like the faculty. What I try to do is bring the real world into the classroom. I got a grant from Covered California, and we hired about 2 or 3 students on about 15, 16 different CSU campuses, developed a 5-minute presentation, went around to faculty all over the CSUs. Everybody let the students in, and we reduced the numbers of the uninsured in the CSU system from about 33% to less than 10%. A little after that, I started running a health policy conference for all of the CSU. And for the last 10 years, we've taken about 100 CSU students from all over California to the state capitol for 2 days. And most of them come away with a much better feeling about how policy is made, how seriously people take it. Cal State's been wonderful because it's given me the freedom to do that, and I think it recognizes the value of it. I had a health policy class once in which the students at the end of the class were pressuring me. So what do I need to know for the finals? I wrote them a poem, and the last verse was, "So focus on some, but consider all. That is where the A will fall. You can be certain, no need to guess. The concept is more, the memory less."